Namaskar, hello and welcome to Sansad TV. I am Namrata Singh and you are watching Samvad Exclusive. We've all heard the phrase health is wealth, but living through a pandemic has given it a whole new meaning. It's no longer just a saying, it's about having a healthcare system that's there for us when we need it the most. India has taken a giant leap towards ensuring accessible and affordable healthcare for all, especially for the common man. One of the biggest steps in this journey is the Ayushman Bharat Pradhan Mantri Arogya Yojana. The scheme has transformed healthcare in India by providing coverage to the most vulnerable, becoming the world's largest health assurance program. In a major boost, the Union Cabinet recently extended PMJ to cover all senior citizens aged 70 and above, regardless of income or background.
चुनाव के समय मैंने गारंटी दी थी कि तीसरे कार्यकाल में 70 वर्ष से ऊपर के सभी बुजुर्गों को आयुष्मान योजना के दायरे में लाया जाएगा। आज धन्वंतरी जयंती पर ये गारंटी पूरी हो रही है। अब 70 वर्ष से अधिक उम्र के देश के हर बुजुर्ग को अस्पताल में मुफ्त इलाज मिलेगा। ऐसे बुजुर्गों को आयुष्मान वय वंदना कार्ड दिया जाएगा। सरकार का प्रयास है कि देश के हर बुजुर्ग जिनकी आयु 70 वर्ष के ऊपर है, उनको जल्द से जल्द आयुष्मान वय वंदना कार्ड मिले। और ये ऐसी योजना है जिसमें आय की कोई पाबंदी नहीं। गरीब हो, मध्यम वर्ग का परिवार हो, उच्च वर्ग का परिवार हो, हर कोई इसका लाभार्थी बन सकता है।
So to help us better understand this important move and explore the broader impact of Ayushman Bharat PMJ, we are joined by a very special guest, Dr. V.K. Paul, member NITI Aayog. Dr. Paul is a leading medical expert who has been at the forefront of implementing Ayushman Bharat. A globally recognized public health specialist, he has played a key role in formulating not just PMJ but also the Ayushman Arogya initiative and the Poshan Abhiyan. Welcome, Dr. Paul, and thank you so much for joining us.
Thank you, Dhanyavad. Thank you for the opportunity.
Dr. Paul, before I begin the discussion, I would like to quote one of your articles where you had mentioned, you told a story about a boy who was going through some heart ailment and how his father had to sell his land and everything for his treatment. But somebody told him about this PMJ scheme and how he enrolled into the scheme.
His father discovered that actually he is and his family is a beneficiary of Ayushman Bharat PMJ scheme,
right,
which he was not aware of. And once you are a beneficiary based on the list, which is the SEC database list, then you are entitled to all the benefits. So that's what he discovered, and then making use of this, the heart ailment was taken care of, a huge sum which was required to be paid perhaps by the family was eventually paid through the PMJ, and free treatment happened, and this young child is healthy now.
Right.
There are many such stories,
right,
perhaps lakhs of them by now.
Right, sir. So this shows how the government's commitment towards giving a holistic healthcare system for the country. So, Dr. Paul, and the recent expansion of the PMJ scheme to include everyone above 70, and only previously, vulnerable section of the society were covered under the scheme. But now all senior citizens aged 70 and above will receive this health coverage. For our viewers, if you could help us understand how this expansion will benefit these families, and most importantly, is our healthcare system prepared to handle this increased demand?
Let's start where PMJ has reached, just to to emphasize the fact that Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, PMJ, envisioned by the Honorable Prime Minister, presently covers 12 crore families. And
Right.
these are the bottom 40% of India's population. They are recognized through a particular system which we are improving continuously. But that's the coverage. 12 crore families, and this translates roughly to about 55 crore individuals. Now, it's a national scheme. State governments, through their own resources, have used the PMJ platform and the assurance, and they have added additional population on top of this, and the total then actually works out to be about 67 to 68 crore, like half of India. But let's say the original import, 12 crore families, 55 crore individuals is the current cohort. They are covered to the tune of rupees 5 lakh per family per annum, having access to more than 1900 care packages or procedures or admissions for those care packages, treatments, let's say. And this is being delivered through about 30,000 hospitals, of which about 1/3, 12,000 or so, 11 to 12,000 are private hospitals. So this is the size of the Ayushman Bharat PMJ, and it runs paperless, cashless, and uses a high quality IT backbone through which this whole operation occurs. And at the hospital end, there is an Ayushman Mitra, a friend of the beneficiary who is facilitating all this. So that's the way broadly it is working right now. 7.8 crore hospitalizations have taken place under this scheme till recently. More than 1 lakh crore of saving has accrued to the beneficiaries by way of having come through the PMJ system to seek care. So look at the size and the scale of the scheme. Now, moving forward, a very major decision has been taken, namely to include all our citizens who are 70 or above as a part of beneficiary cohort for the PMJ, 70 and above. Importantly, there is no exclusion for this age group. Everybody, universally for all citizens of India, irrespective of socio-economic status. So earlier, essentially, we were working with 40% bottom
2 quintile.
2 quintiles roughly.
Right.
Okay. But now this layer by age is applicable to everybody. Now what does it mean? It means that it will benefit 4.5 crore families, and it will benefit 6 crore individuals. Let me just add to this. PMJ, out of these 4.5 crore families, was possibly covering, we estimate, 1.73 crore already
Okay.
were being covered.
Okay.
Because जब हम उनको दे रहे थे तो उस परिवार में 70 वाले भी कवर हो रहे थे,
Right.
लेकिन उसके लिए उनको अब एक्स्ट्रा फ़ायदा मिलेगा, उसको मैं भी समझाता हूँ. लेकिन 1.73 करोड़ लगभग पहले से कवर हो रहे थे. 1.73 आउट ऑफ द 4.5 करोड़ फैमिलीज. 2.77 crore additional families, irrespective of socio-economic status and previous beneficiary status, will now be added. And this amounts to an addition of 3.85 crore new individuals and 2.15 crore new families into the ambit of PMJ. Right? Overall, the message, 4.5 crore families will be benefited and 6 crore individuals will be benefited. An important part is as follows. Imagine those who were already beneficiaries, if they had a senior citizen of this age group and more, was already being covered in that 5 lakh benefit.
Right.
तो पहले से ही था.
Yes.
Now what will happen is that for the elderly, let's say 1 or let's say 2, there is an extra cover of 5 lakh for them.
This is beyond this 5 lakh.
Exactly. And for the rest of the family, another 5 lakh. So those who are PMJ beneficiaries, that means the vulnerable, they will now have a, you can say, dual cover for The elderly 5 lakh cover by itself per annum, one of them, two of
Right.
them,
Right.
and for the rest of the family 5 lakh, and they don't have to exchange with each other. So that's an additionality to the existing beneficiary families. What about those who are not part of PMJ? Till now, for them, if they have an elderly in the family, one or more, then that family, irrespective of socioeconomic status, universally will have a coverage for family 5 lakh per annum for all the other benefits, for the benefits of PMJ.
Even, the scheme applies to the senior citizens who are already covered under public health schemes like CGHS, then you have ECHS, then Ayushman CAPF. So, how the scheme is applies to...
Yeah, it needs to be understood one by one.
Right.
So, let's start with the individuals who have existing private insurance from their own pocket. There will be no exclusion. They will be included in this, irrespective of socioeconomic status. If I have private, I have insurance, I have paid, no problem. You also have additional benefits
So,
now.
they can avail both
Of course.
private as well
Yeah,
as...
because that's my own money that I have used,
Okay.
right? And this is coming from the government. This is coming from the public, from the public money. Likewise for ESI, where there is a contribution of the employee and the employer, that benefit stays, and additionally the PMJ benefits would be available. However, if you are a beneficiary of a government scheme, right, CGHS, state such schemes, state employee schemes, for example, or CAPF.
Right.
These are the Central Armed Forces,
Or ex-servicemen.
and ex-servicemen from the army.
Army.
Now, so they are already getting coverage from the government source, right? Government funding. There will be no double dipping, because this is also government. It's the same pot of money in a way. So for them, they have to choose. I, as an ex-serviceman, will choose whether I continue with ECHS or I would join PMJ. And the logic is very simple, that it is coming from public money, the government funds,
Right.
okay, and you can't have that being dipped out twice. But there, it's my private insurance, I have paid the money. ESI beneficiary is giving contribution from his or her own pocket and employer contribution. Their additional benefit is now being made available. So basically applying the principle of universality, but not dual dipping.
So, but sir, in Ayushman Bharat PMJ, so there is a capping of 5 lakh.
Indeed, yes.
Yeah. So, but like in CGHS, if you could explain, does CGHS also has this capping, or how will it
CGHS
benefit?
is open-ended, shall we
It's
say.
open-ended.
Yeah.
Right.
CGHS also is much more liberal in its own way.
Okay, so people will
People
have
will
the
choose.
option. They'll
People
choose
will
whether they
choose.
want to avail Ayushman Bharat PMJ or CGHS.
That's right. That's their choice. For example, PMJ network of hospitals is very large, and there may be some advantages to people. And so let this be chosen by the people. But the principle is that universal access to health care for secondary and tertiary hospitalizations is now available to everybody.
Also, one thing I would like to ask, that is our healthcare system prepared to handle this increased demand, sir?
Well, you should remember that when we are moving forward with universal health coverage, you have to be pressing different buttons and different pedals to be able to move in that direction, right? Currently, as I said, almost 29-30,000 hospitals are apart. Sure, and they are not filled up all the time. There are spare capacities. There is no doubt. We can do the numbering game. There are spare capacities. But at the same time, we do also like to see many more hospitals to be built, many more opportunities to be available close to people at tier 1, tier 2. So that journey of a larger infrastructure should continue both in the public sector as well as in the private, because with PMJ, it's only one continuum. Public, private is all part of one system responding to the needs of the people. And that's one big achievement of the Honorable Prime Minister's program, that has brought public and private sector together for a big cause, a lok kalyan की एक aim के लिए उसको इकट्ठा कर दिया गया है, right? Now the spare capacities are there. We will walk the talk. We will move forward, continue to strengthen, the system, but it is needed, and there will be
great
care
initiative.
provided.
It's
Indeed.
a great initiative, yes, sir.
But then, it comes from the fact that this population is the most needy. Let me come why, and why it is so important. It's a great initiative because the hospitalization rate in this population is as high as 11%. The typical hospitalization rate in the PMJ system has been about 2 to 2.5% only. So you can see that compared to the average, for obvious reason, at that age you need more health. So they are more needy, and therefore here is the government responding to the citizens' need and coming forward. One other reason why this age segment is important, because there are more women in this age group. There are 1060 women and 950 approximately men.
Okay.
So there are more women.
Okay.
In PMJ, one of the most fascinating thing is that the consumption of our services, utilization of the services equal, 49% women, and here, so it is women centric. It is responding to the gender needs, and this will continue. So when you help 70 and plus, you are helping more women. Even more importantly, a lot of elderly live alone. We know it, both men and women. But then for women, the likelihood of being alone as a widow is higher. Above the age of 60, 54% women are widows, and this scheme will help, compared to, let's say, about 18%, 16% men being widowers. Between 70 to 79, you may not know, 67%, this is the data, are widows. 70 to 79, and this becomes even higher above the age of. So this scheme will differentially help the most needy women of our society, who are rather often also alone, have lost their partner, and not surprisingly, for circumstances beyond their control, often they are living alone. So it's a big measure for lok kalyan in the most profound sense, and we really should thank the Honorable Prime Minister for thinking about expanding PMJ benefits to this very needy, very special population. And remember, these are the people who have contributed to the society.
Right.
Whole life they have been part of the productivity of the nation,
Right.
the building up of our society, looking after the next generation, and they need a special deal, and that is the spirit with which this scheme has been crafted.
Doctor, how can citizens avail this scheme? I would like to understand a step-by-step process that, because if I am a layman, I don't know which department to approach, what documents we would need to for this particular scheme. So how should one go about it?
Well, let me tell you the generic process that is followed now. The entry is that we should have a card ultimately. Okay. Ayushman Bharat card is my entitlement. It shows that I am a genuine beneficiary. So how does it work? You have an app on which you can generate your own card. Okay. You can go to a common service center, and with a little help, you can generate the card. You can go to a PMJ kiosk in a hospital that's providing PMJ services, and you'll get assistance to do the card. You go to the website, you can create your card. What is needed most importantly is the Aadhaar card, because it is Aadhaar linked benefit. Okay, and the permission is given by the citizen that you can use my Aadhaar for this purpose. And that is perhaps very much the only document that you would really need to be able to give the Aadhaar number. And the list at the back end is already available for the current system, and it matches the list, and based on that list, it creates a card. Now, for the senior citizen, This generic platform would of course be activated, but there will be a special effort to be made.
Okay.
How do we reach out? And perhaps, we have to reach where the elderly are. They may not be in a position to be mobile. We may be actively reaching them the way we have done for COVID vaccination, for example, where they live and in difficult locations, if need be, efforts will be made, and there will be information shared through all channels.
So we have such facilities?
Yes, all channels. All channels mean this is one channel, electronic channel, newspapers, our health workers looking at their own catchment area and the families that they serve. So there will be a very active approach to this. These are the principles that will be invoked. But be rest assured that there will be a very active outreach to be able to get the beneficiaries into the fold of this expanded program.
Okay. Dr. Paul, has the PMJ scheme achieved its primary goal of addressing the healthcare needs of the country's low-income population? How would you assess its journey over the past 6 years?
Let me make 2 points on this. I gave you the number. So 7.8 crore people have used this platform for their care. So first and foremost, that speaks as to what this assurance mission is achieving.
All about, yeah.
When we started, the hospitalization rate based on the estimates of NSS surveys was about 1% in the population, which was vulnerable population that was made the cohort of beneficiaries. Over time, it has picked up. It's gone to 2.23 to 2.5%.
Okay.
What does it mean? That people are now accessing more services, right? And
right.
As I said, for the elderly, it will be much higher accessing services and so on. So more people are accessing services. You may have seen an article by a very eminent economist, Dr. Shamika Ravi, which talks about both the things. It talks about the vulnerability of the families to health shocks, economic shocks, and it also shows how the access has improved. So from the ground, there are evidences that show that this has happened. And also, one aspect to which it should have and has made a contribution is if you look at out-of-pocket expenditure. Out-of-pocket expenditure in 2014 was 69% of total health expenditure. It has come down in 2021, despite COVID, to the tune of only 39%. So there are other reasons for it. For example, Jan Aushadhi scheme and dialysis scheme, etc. Sure, and free drugs. But clearly, part of it is being contributed also by the Ayushman Bharat PMJ scheme. But we will see as more data comes up. But as I said, if all the individuals were to seek treatment on their own, the cohort of 7.8 crore individuals who had hospitalizations under this scheme would have spent more than 1 lakh crore cumulatively. That saving has accrued to the people of India.
In fact, I would like to talk about this out-of-pocket expenses because recently there was this data which showed that 60% of the rise in spending of GDP has increased since 2013-14 till now.
Yeah,
how do you assess this trend, sir? And what is this out-of-pocket expenses?
So the first point is that between 2014-15 and 21-22, the government health expenditure as a proportion of GDP has increased from 1.13% of GDP to 1.84% of GDP, which is a 63% increase over this period of time. So government, center and state collectively have put more money for health, really being led by the center's many initiatives. But it's a partnership of both center and the state. So that's one. Per capita terms, government health expenditure, if you translate that into per capita, then in 2014, it was 1,108, let's say 1,100. Okay. And in 21-22, it is 3,156, almost 3 times. So clearly more money is being put on the table for health, and this has contributed to the infrastructure that has come up. coverage of immunization that has come up, and the outcomes that you see in terms of improving life expectancy. But if you see as its help toward reducing expenditure of the citizen from the pocket, which I as a citizen was putting on the table per capita, that has diminished. So as a proportion of total expenditure, we have moved from 63% to less than 40%, 39%. So there are indicators, clear indicators, that the stress on the citizen for money to be spent for health shocks, that stress has diminished. And one of the major schemes that's doing so, as in the case of that family whose child was treated at the cost of 1,83,000 in a facility for heart disease, that kind of a expenditure is being, is now being protected. Citizens be protected from that kind of an expenditure thanks to PMJ. It does not mean that we will not continue to improve efficiencies. It means we are committed to addressing the grievances, if any, in relation to PMJ, and bringing in more robust anti-fraud measures. That journey continues. But overall, you can see that among the flagship missions of our nation, under the leadership of the Honorable Prime Minister, PMJ has delivered in a very, very big way.
Right, sir. You were also talking about the states, the implementation of the cost of implementation is shared between center and state.
Yep.
So, is there any mechanism to monitor how these states implement this scheme, and is there any flexibility given to the states in terms of the cost?
It's a central sector scheme, which means that center and state work together to implement the scheme and also fund the scheme. Okay. Typically for PMJ specifically, 60% of the funds come from the center as a commitment, and 40% come from a state. For union territories, 100% from the state, from the center, because that's union territory. So the union pays for it. For the Himalayan states and hill states, 90% comes from the center. So that's the way it works. It's a partnership. It's a national mission in that sense.
Right, sir.
Now the standards are set by the center. IT platform is run by the center. So the center has a national health authority, but the corresponding structure in the state is state health authority, SHA, and they work in unison in a perfect seamless way in a federal, very effective federal system. The scrutiny of claims is a shared process. There is a layer that's handled by SHA, but then standards and oversight is provided by the center. Okay, the state is in the forefront to do so.
Right.
But there are some flexibilities. As I said in the beginning, if a state chooses to say that based on the center's guideline, this is the population that would be covered in a state, we do the estimate. State can say, no, on top of this, I will add additional population.
Okay.
But the state will say, we will pay fully ourselves. So for this layer on top, running the same platform of the PMJ, this much, the budget for this population then will be borne by the state.
Okay.
Right? States are given choice to an extent for the packages, but we encourage them to align with the most advanced package that's available. So there are flexibilities, but then overall structure is very, very national.
Okay. Okay. Dr. Paul, there are concerns about awareness of government health insurance schemes among vulnerable population. And then there is this data, a 2021 Pan-India survey indicated that while over 70% of households were aware of the PMJ scheme, awareness is notably lower among the bottom two quintile. So what are the challenges you face in addressing this gap between awareness and accessibility?
It's a very important point, because the beneficiary should be really told, should know that I have an entitlement, and all I would say is that the efforts that are made by the states, by the district authorities and the central government teams are enormous in this regard. But yes, there are some people who, for whatever reason, get left out. I would only say that all state governments and the center are totally committed to reach to the last beneficiary of this as well as other schemes where we are working together, because that's our duty. But then, as I said, there are on the ground practical difficulties. There are people who migrate out, migrate in. Some are really in pockets where the outreach may be difficult. But the fact remains, the commitment on the part of the system is profound. And if there are other ways of helping this process through people, through NGOs, through the government system, awareness through all media, we are committed to take all those paths, and we hold us accountable and all the teams accountable in this regard, and we can do more as we move forward. I must also mention one important feature of Ayushman Bharat PMJE is portability.
Okay.
If I'm a beneficiary in Assam, right, and if I go to another state, X state would honor my PMJ status in my state of origin.
Okay.
So as a beneficiary, I have pan-India portability. Of course, there are states, West Bengal and Delhi, and more recently Orissa. Hopefully, Orissa should join, who are not part of PMJ, unfortunately, but I'm sure they will. But barring these three states, 2 states and 1 union territory, the portability principle is an accepted principle, and we would like to see seamless access to services by those who seek portability principle, because they are in a different location when the need arises. And that's in one way why this is truly a national scheme.
Right. It is truly indeed a national scheme, because health and wellness have now become a key focus in policies, and especially after COVID-19. So, and now these health issues are central to election manifestos. What are your thoughts on these trends, and how can we make sure that these are not just election promises but actual commitments to governance?
It's good to have these issues being talked about on the election manifestos. If you go back a few decades, such issues were not on the agenda. And if you look at the developed nation in the West in particular, health is always a very major issue in election discourse. So we have moved to a space where health services, health assurance in particular, is on the agenda of political parties and their manifestos. And I'm very proud that our government is delivering on those commitments. And they have led the way how to transform the health system, A, and B, to ensure pathways that take the health services to the people, connect people to the opportunities. So I think this is a wonderful development, because health is so crucial. Going toward the goal of Viksit Bharat 2047, we need healthy people to drive our nation's productivity and wealth creation. We have to be healthy. We have to avoid sicknesses and ill health, so that we don't lose productivity, and the second, that one don't have to spend on future illnesses and hospitalization that will be so much more costly. And therefore, equally important is the reason to appreciate the second limb of Ayushman Bharat as announced in 2018, which relates to comprehensive primary health care through Ayushman Arogya Mandirs, or Ayushman Bharat Health and Wellness Center mission. And 175,000 plus of these centers have now been established since 2018. 140,000 new healthcare providers, community health officers have been put in place to provide primary health care across 12 packages, including, screening and detection of hypertension, diabetes, 3 cancers, and free drugs to the tune of, as high as 172 drugs and more than 40 diagnostics and so on. So the health sector indeed is undergoing a very dramatic and unprecedented transformation in multiple ways. And the flagship program of ABPMJ, now getting expanded to 70 years plus citizens of India, is a proud next stage of this evolution, and clearly in the service of the people of India, in the service of the nation. This is a great development.
It is indeed a great initiative of the people and the government, and Ayushman Bharat scheme not only addresses immediate health needs but also reflects government's commitment to strengthening healthcare services across the country. Thank you so much, Dr. Paul, for joining us here on Sansad TV and for this insightful discussion.
Thank you.
Indeed, Ayushman Bharat PMJ is poised to play an important role in building a Viksit Bharat. As we continue this journey towards universal health coverage, we look forward to seeing how these initiatives will create a brighter and healthier future for all citizens. Well, viewers, that is all I have for you for now on this show. Stay tuned and thanks for watching Sansad TV.
To watch more programs of Sansad TV, subscribe to our YouTube channel and don't forget to like and share them.